I think the critical thing for the industry is to understand, first of all, that healthcare across the globe is a cottage industry. It's still vested in many of the precepts of the 19th and 20th century. It's been bypassed by revolutions in digitization and efficiency drives to try and make it a joined-up system. This is a universal truth. It's not specific to any particular country. Secondly, we have a healthcare system that is really very good at dealing with acute episodes of ill health and injury. It's even better now with minimally invasive surgery and quicker turnaround times. What it's not well adapted to is the complete change in the burden of disease across the globe, and particularly in the developed countries, where we have moved from a health environment in which infectious disease was the major cause of illness and death, to now where it's non-communicable disease. And most of the non-communicable disease is down to individual behaviours. Those include smoking, alcohol consumption, and obesity. So we need to struggle, I think, to understand two things. First of all, that the expenditure that we're putting into the healthcare system now is reaching its limits. There's no model in the world that is sustainable against the additional demands that these ill health conditions are causing us. And secondly, healthcare only addresses 10% of the total problem. Genetics play a major part in our propensity to have diseases or poor health. But the other part is what I've just called other stuff. And the other stuff is, for example, physical inactivity, poor diet. Some of it is within our control. Some of it is not. For example, poor environmental conditions such as air pollution. But the challenge, I think, for the industry is not providing a single magic bullet solution that we can design communities which will induce activity. I think it's working with all the other partners to try and turn around a global phenomenon of wealthy countries that's heading doggedly in the wrong direction.